Ollie, and this is my partner, Miss
Hi.
Amanda. And our topic today is Trichuriasis, right?
Right.
Okay,
Which is actually a roundworm
in round one.
that infects your body.
Good. And this is most prevalent in hot climates and cold climates.
Those severe climates. So
Just
think about that next time you decide to travel.
good. And children are more susceptible to this infection because of fecal oral route exposure, so contamination.
So think about that next time you're playing in the sandbox.
Yes. Um, let's roll this. So again, it's a flatworm. The genus is Trichuriasis, and the species is Trichuria, and the disease it causes is Trichuriasis, right?
Correct.
Okay. Again, it's prevalent in Asia, Africa, South America,
Even the
and
US.
even in the U.S. Estimated 2.2 million people have it in the U.S. Well, most are migrants. And then, interesting, however, there's a genetic component. Studies have shown that some of the trait has been tracked to chromosome number 9 and 18. Essentially, that creates more susceptibility to the infection. Again,
It resides in the lumen of the intestines. The baby, the larvae start off in the small intestine and then they travel up to the large intestine where they mature. And that's where they start shedding their eggs that goes through your colon into your fecal matter, into the dirt, which is where we wind up eating it if you're not washing your hands or food properly. But
yes,
it's important to note that there's an animal form as well as
that's a
human
human
form.
form, different species of the Trichurious species.
And unfortunately, the animal form can infect humans.
Absolutely.
Yeah.
And the life cycle again is just from fecal, oral to the intestine, back to the fecal, back to the mouth, and the cycle goes on. And however, though, the intestinal lifespan, the lifespan of the parasite in the intestine can last up to 3 years. And oftentimes, the victims are symptomatic, but that creates more time for that parasite to multiply during
Yeah.
that process. Severe form of the infection do lead to prolapse,
Yeah.
especially in children.
So we've got another little summary of the
Life cycle
life cycle. If you guys click on the recordings through the slides, it's a little bit more in detail.
in detail.
Yeah.
Good job. The clinical manifestations include abdominal pain, bloody diarrhea because the parasite is eating at the intestinal lumen.
They
The-
burrow in there, and as they
I-
burrow, it disrupts your tissue, and that causes bleeding, which
Bleeding.
can lead to chronic anemia.
Absolutely.
And it disrupts the intestinal absorption of different nutrients, leading to malnutrition and weight loss, specifically vitamin A deficiency, which can lead to retarded growth development.
Absolutely.
Yeah.
And other complications. This can also manifest or translate into stunt growth, cognitive deficits, and other abnormalities that has to do with developmental milestones.
Yeah, appendicitis, colitis, proctitis, and finally, reinfection. Very common complication, especially if you're living in a country where you don't have the resources to avoid it properly.
Good. And how do we diagnose this? Well, there is no specific gold standard other than standard microscopic observation of the, you do a wet mount and do a microscopic observation, 40S, 60S, 75S, or 100S. But the eggs can be screened first once the egg is seen or the larva is retrieved directly from the fecal particle. And then,
Well, unfortunately, it takes 3 months of living in your intestine for them to start shedding eggs. So you can have it for 3 months before there's even any eggs in your fecal matter.
and by then they've multiplied and multiplied and multiplied.
So, in addition, we can do endoscopies, which would allow us to visualize the worms inside the intestines, or your cytokines would be elevated as your body's trying to fight the inflammation in your GI tract, or there would be perhaps.
Molecular screening, like serology test for interleukin
Right.
25, and
Or yeah.
go ahead.
Perhaps the family dog might get sick and come down with that, and then maybe it's a good time to take a look at maybe what's going on with your son or daughter that's having chronic diarrhea.
Yes, and the ESR will be higher if we do a lab work because of the presence of inflammation of the intestinal walls, and sometimes the white blood cell can be elevated. Sometimes. What are the treatments? Well,
Of course, we want to treat the underlying infection. Yeah.
and what's it? Albendazole,
Mhm.
the azoles category,
Yes.
essentially.
The mebendazole, albendazole,
Albendazole,
the oxantel are all to treat the specific infection. But then we also want to treat the complications, the anemia, the vitamin deficiency. Maybe get into some developmental programs, and then nutrition. And then, of course, part of treatment is prevention, preventing reinfection and hygiene and
hygiene, education, understanding the transmission circle, the mode of transmission, the reservoir, the parasite itself, that triangular framework of host parasite interaction.
That vicious cycle.
Yeah. And hand washing, very critical. Boiling food, in the right temperature, and cooking food to the right temperature, and maybe in many developed countries, educating them to boil their water, because most of them have access to unsterilized water.
Yeah.
And that is a huge problem in developing countries.
Or even treating your animals. Interestingly, these antibiotics we mentioned, they are safe to use on your dog or your cat. And so if they also have it, they're part of the family, they need to be treated too.
Absolutely. And but the key is still education. There's no vaccine against it.
No
vaccine. So education.
They don't teach this in dog school.
So what are the implications for advanced practice nurses? Well, everything goes back to education.
And hygiene. Cleanliness.
And cleanliness.
Yeah.
Cleanliness. Prevention can save a whole lot compared to the diagnostic and curing processes.
Things like the eggs, they die with dehydration, with heat, like temperatures above 52 degrees Celsius or below negative 9 degrees Celsius,
Yes.
or ammonia. So proper cleaning techniques.
Cleaning.
Yeah.
And for health promotion, again, hand hygiene, hygiene education, clean access to water, understand the whole framework of the disease. And as one of the framework for health promotion, we have to increase the surveillance. Just because it takes 90 days for them to actually start shedding the eggs, by then, wow, it's suddenly replicated a whole lot.
The females shed 10 to 20,000 eggs a day.
A day.
So once you've got 90 days of them living in there, it's exponential.
Yeah, so surveillance is the key.
And then
prevention and then surveillance to look at the risk factors, identify those early risk factors, and then to make the appropriate intervention.
I was reading in some developing countries, they have nurses that go and they visit and they do deworming programs in the schools where the parasitic infections are common. Just how in the States they used to do lice checks on all the schools. They have days where they routinely go in and they deworm the children.
That's what they're doing because it's most prevalent and endemic in some areas. So, prevention strategies again, understanding the mode of of transmission, fecal, oral, very critical. And within that template, in the middle is hand hygiene, effective hand hygiene, good hand hygiene, education, humans and pets, how to recognize these early signs and symptoms even on the pets is critical.
All right.
Safe drinking water and hand hygiene. Thank you for your time, and
thank you.
Thank you.